Hey there! Welcome to Caffeinated Chest Cases. My name is Dr. Seikei and I am a thoracic radiologist. In each episode of this video series, I'm going to walk you through a case in about the same time it will take for you to finish your coffee. Well, at least if your choice of coffee is a long one and not an espresso. Okay, so let's take a look at our first case. This is a 58-year-old male, asymptomatic, non-smoker, who had a pre-employment chest radiograph. If you take a look at this image, I'm pretty sure that you can spot the abnormality, which is situated at the level of the carina in the middle third of the right lung. This is a 1 centimeter large rounded opacity, which was suspicious for a pulmonary malignancy. Also note this lucency up here in the apex, which is not a true lesion, rather it is a developmental variant. Let's take a look at the CT now. Here I'm showing you the axial and the coronal lung window series. And if we scroll through this stack of images, here we are at the level of the carina, here at the lung apex, and there's actually no parenchymal lesion that could have caused that opacity, which is good news for the patient. But the question still remains, what caused the opacity on the chest X-ray? To answer that question, we need to window the image in a way that the bones become more conspicuous, and if we do so, then older rib fractures reveal themselves. Here you can see an older fracture on rib number 3, rib number 4, and rib number 5, out of which the fracture on rib number 3 was the one that caused the opacity on the chest X-ray because of this prominent callus formation. You can also take a look at this on the coronal. Here is the prominent callus formation. As for that opacity that I mentioned in the lung apex, let's go up towards the upper part of the lung and start at rib number 1. This is the dorsal aspect of rib number 1. This is rib number 2, and let's follow rib number 2 as much as we can. And here you can see that rib number 2 and 1 are actually connected. Here is the coronal. This is called a rib fusion, and as such, this is a do not touch lesion, meaning that all you have to do is just to recognize it, and there's no further imaging required. I hope you like this case, and I hope to see you back next time on another episode of Caffeinated Chest Cases. Please note that you will find the links of these cases in the description of the video, so you can take a look at this in your free time, and you can download it or use it any way you want. Goodbye.